the sensitivity. But at the same time, before starting my guideline, I have to tell you what is going on in the world. This is not the phase 2 or phase 1 studies. US FDA has approved semaglutide and sabotagine. So with this introductory presentation, I would like to go on our presentation. This is forward from our previous presentation, and this is the presentation with our this revised. Imagine our society has successfully developed guidelines for the treatment of chronic hepatitis back in 2009. In view of the recent tremendous development of newer directly antiviral drugs, Pneumonia Liver Society has decided to revise the 2009 guidelines for the treatment of chronic hepatitis B. Because of this development of these newer drugs, we decided to develop a new guideline or revise our guideline. Therefore, second edition of revised consensus Myanmar GI guidelines for the treatment of HCV was unanimously approved by the GI and liver specialists. Hey, sorry, a minute. Hey, all right. And independent reviewers from other specialties. We do hope that second edition guidelines will be able to provide current knowledge about the treatment of chronic hepatitis infection, which will be helpful in the practical management of chronic hepatitis C. It is to be stated that emerging will revise the guideline periodically as necessary. Finally, Pneumonia Liver Society would like to express sincere thanks to everybody who participated actively in the development of concept guidelines. We would also like to express our genuine thanks to Roche Pharmaceutical Company for the unlimited educational support for the development of second and revised guideline. Any comment, any suggestion for this? Fabio, we a little.
No, I don't think it would be necessary. Please carry on.
These are table contents. Introduction. Chronic hepatitis is a major health problem in Myanmar with relatively high morbidity and mortality. Studies by Kierman and Taisaw showed prevalence of NHCV antibody among the blood donors in young was 2.5% and 2.9%. NHCV antibody are present in 54.10% of patients with cirrhosis of liver in young hospital. HCV RNA was 23.1% positive in patients with HCC in Yamamata hospitals. With the rapid expansion of the knowledge about the hepatitis virus, newer diagnostic and therapeutic agents come to existence. Pegylated and bromine riverine are available in Myanmar, and one of the DAs will be approved in Myanmar in the very near future. Therefore, practicing physicians should be aware of the current trends in the treatment of chronic hepatitis C. It is also considered that for all the physicians in Myanmar treating patients with chronic disease infection, there should be a consensus practice guidelines with the local relevance. For the reasons aforementioned, this treatment guidelines is developed by a panel of experts, consists of hepatologists, gastroenterologists, and independent reviewers, namely dermatologists and scientists. Tao Bamya Pyo Shiva.
No comment, but it is a introductory remarks.
Yes, but we don't want to change anything what we have presented.
This guideline recommendations are mainly based upon formal review of the recent publication. The preparation of this document is mainly based upon the following guidelines. 1. AS study practice guideline, diagnosis, management, treatment of chronic hepatitis B, update 2009, is very old. Asian Pacific episode study concept statement and management for the chronic hepatitis B 2012. But quite recent, EASL, European Association for the Cell Liver, clinical practice guidelines, management of chronic viral infection, November 2013, still in press, not yet published. And the panel expert local experience. The guideline is developed to provide information to the physicians and general practitioners in Myanmar, to all healthcare providers, including nurses, including everybody, for the treatment of chronic hepatitis infection and for referral to a specialist center when appropriate. However, the treatment policy of the attending doctors should be flexible and the guidelines should only serve as reference. Recommendation. This guideline should be a useful and practical reference for Myanmar physicians and healthcare providers who are treating patients with chronic hepatitis C or taking part in a treatment program like a nurse educational providers.
Well, Professor Win, the guidelines, as you know, I was one of the moderators and I accept the guideline. However, the treatment policy of the attending doctor should be flexible and the guidelines should only serve as a reference. Now, we have used the usage of the word attending doctors. How much they are knowledgeable. So whether we should reframe it, this sentence, because the people here are the authorities for the showing of the guideline and showing the beacon how they have to do it. But the statement says that should be flexible. And whether they have carried out, they should amend it. Like the personal opinion, I've been in the district and for quite a long time. Honestly, they don't have the knowledge to do it. So, what do you think about that? Go ahead.
Oh, just a minute, I'm asking you.
As for me, I think the treatment policy of attending doctors should be flexible and the guidelines should only be served as a reference. I think it should be there. Because generally speaking, like you said, a lot of them are that knowledgeable to treat a condition. But in general, there must be a chance given to a practitioner to think in the way he wants. That is what I think.
So, should be flexible, Shweta. because, although we have done the guidelines, they may not adhere to the guidelines that we have written on it.
I think there is a danger in this Senate, because the main purpose of developing a guideline is to give guideline for the whole healthcare professional across the country, and the treatment should be standardized. So if they follow the guidelines, the treatment will be standardized because it is based on the current evidence. But if we mention the flexibility, then there's some weak point.
Yeah, I know
If
that
they read the guidelines, and then because it is mentioned that it is flexible,
Yeah,
they might deviate.
they have the liberty to do whatever they like.
Yeah. And another point is that whenever we develop a guideline, I mean, I have some guideline here, guideline for the guideline development, guide for the guideline development, and the guide, there's several documents. That's how how to develop a guide. The first important point is the scope of the guideline. According to our guideline, this is written, we have developed last 2 years, 3 years ago. Now I'm reviewing. It is for healthcare providers. All healthcare providers. It is aimed not only for the physician and general practitioner, but also for all the healthcare providers.
Yes.
By meaning that the healthcare providers, the LHP, midwife, etc., will they be able to use this guideline? Are they the standard? The standard, are they be able to cope with that guideline? So,
all healthcare providers, so the federally and for the referral, abomination. Physician healthcare providers who are attending treating patients with chronic disease or taking part in the treatment program. Nurse, healthcare provider, HA, I don't know so far. The minute Sella, healthcare to do Biolo,
flexible.
down and then they say,
Flexible is another thing.
guidelines go general guidelines will do it on yes, you can.
Siala Biora, I perceive it. At the same time, this is a national guideline to law. Something as a gospel sort of a truth in it. Pure message or to new one. We call our national guidelines to call it. National guidelines are very strong. Guidelines are society, organizations, associations, they are paid with them. But guidelines are based on meta-analysis by it depends on the guidelines. They think there must always be a chance for the practicing clinicians. Some attempted to go to no time. When a patient is treating a patient with hepatitis C, we should regard a person as he knows something about hepatitis C. Anyway, the won't harm is solution. There's the general rule to be body, although I agree to you, there must be some sort of flexibility in anything we do, unless it is a very sort of a gospel sort of a thing. So that is what I feel.
Can I enact
without mentioning that, flexibility by now, mention
New York Hospital guidelines, guidelines, ကိုရင်းကြိုက်လို့နေရတယ်။ဒါပေမဲ့ဆရာတို့ကျွန်တော်တို့ we are in these areas work in the hospital of Pakistan. You could not deviate from the guidelines. The hospital administration will take care of you. So I think whether we should rephrase this our views.
rephrase တဲ့ဇာတ်ပေါ်ဆရာလည်းကျွန်တော်ထင်တာတော့အိုးဘယ်လိုပြောမလဲဆိုတော့ကိုဘက်ကတရည်ဒီလိုလုပ်ကိုလုပ်ရမယ်ဆိုတာပြောမယ်အစားသူ chance ပေးတဲ့သဘောပါအဲ့ဒါမျိုးဒီမှာဘယ်လိုလေးပြောရင်ကောင်းမလဲ
without mentioning it but
without mentioning it
ဖြုတ်တယ် because I mean what
ဆရာကလည်းပြောတာလေ depending on the local situations အဲ့ဒါမျိုးပေါ့လေကျွန်တော်ဆိုလိုတာ
that ဒီလိုပါဗျာ now these days တော့နော်I've been involved in the global guideline ကျွန်တော်ဂျီနီဗာလေမှာဒီဘက်လေတော့မြန်မာမှာပါနေသူတို့ကတော့အဲ့ဒါမျိုးကြားလို့ကျွန်တော်မပြဘူးပေါ့ because my general understanding is that there are two things guideline and protocol they are quite different if we are talking about the protocol whoever the practitioner is whoever the person who is reading who is adopting the national guideline they cannot deviate because it's a protocol. Protocol is very strict in the sense that they cannot be modified at all. Whoever the practitioner is,
SOB box.
yes, because it should be standardized. But what in case of guideline, by nature, it is flexible. It depends on the expertise of the doctor. For example, Professor Tansit. He is a hepatologist. He might not necessarily follow these guidelines very strictly, according to the expertise. But as for the general practitioner, they must, because they don't have any expertise, they should follow it very strictly. So, in other words, it is flexible, depending on the expertise of the doctor, medical practitioner. So this is the nature of the guideline, intrinsic nature of the guideline. So having said that, we are developing the guideline, we are not developing the protocol.
Yes.
I don't think it is necessary to mention here the flexibility here. It's already intrinsically.
I view it this way, in the sense that from the heading itself is a guideline. It doesn't mean that it is a must. When you say it is a must, it is a protocol, you have to practice. If you don't do this, you'll be fine. But when you say it's a guideline, it's something that is guiding you. And in that case, you don't need to be flexible. That is the message that you want to get.
Yeah.
Okay.
Mr. Chairman, Mr. Chairman,
Okay.
yes
Okay.
can you look at this? The treatment policy of the treating doctors should be flexible. However, the guidelines, this guideline.
The treatment policy of the attending physician, doctors, should be flexible. However, the guidelines should serve as a national, when we are using the word national, national reference.
Now, if you still want to use that, may I humbly suggest, shall we put in some modifier after the flexible? The treatment policy of the attending doctor should be flexible according to their level of expertise.
Yeah, and that will be better.
If you are reading the guideline, because you are the guru, then you can modify. Professor Tanse is the expert, he can modify. But, for example, junior doctors, they don't have any expertise, then they should follow it strictly.
If you look at in the later part of my presentation, you'll find that this guideline for is for the treatment of a simple, straightforward case of chronic hepatitis C.
Yes.
In complicated chronic hepatitis C or special cases should be referred to the national the liver specialist. Anyway,
just go ahead.
Well, I don't know, the flexible now, depending on the expertise or depending on the expertise of the practitioners.
Oh, it is very hard to explain and discuss the delicacy of the individualism.
What, just a suggestion, what Andy is suggesting, what should be adaptable.
Adapted to the local situation instead of saying flexible?
My worry, my concern is that it can mislead and it can misinterpret it by the general practitioner. Where this is the guideline, where it is flexible, we do whatever we like.
Yeah.
I don't want it to happen, honestly.
At the same time, just for the
Okay,
sake
okay.
of the argument,
we will delete this. Delete.
Matero.
The triplet policy of the Chinese doctor should be
Toyo Gayo treat no yellow.
follow the guidelines as much as possible.
Or adapted to the local situation?
Okay.
And I got all, we avoid the danger and I don't do that.
Okay.
Because general theory is the nature is of the guideline. Intrinsic nature is the guideline is flexible. If we do it, if we understand it very clearly in our heart, then do our flexibility has to be done. And flexibility is the level of practice.
So we don't need to mention the flexibility to
We don't need to.
people
Flexibility is already there.
because they
Okay.
misuse it. No lah.
ဖြုတ်လိုက်တဲ့အခါကျတော့ဆရာဒိန်းကြအနေနဲ့တက်တာပါ
ကိုယ်မလို့ပြောရတယ်။ဟုတ်။အဲ့ဒါ opinion.
You know, practical taking part in a training program. Yeah, recommendation.
Okay. Shall we proceed?
The guidelines should be used.
Never two here around it. Who should be tested? Because of the high prevalence of incident of epilepsy in Myanmar, anybody attending clinics in hospital for any illness or for routine medical checkup should be tested for NACV. Because a lot of NACV patients in Myanmar are not only in Myanmar, all over the world, they do not know that they have NACV anywhere positive. Therefore, hospital should also be tested if a member is found to be positive, because of check,
But drink.
No dinner, but we can make without drink.
Okay.
Mr. Chairman,
Yeah.
you do 2.1.
Yeah.
For the,
Because of the high prevalence.
hey, hey, John, not in
Okay. Okay.
Hotel. In Myanmar.
Let us go to the recommendations, especially with regards to anti-HCV antibody testing. Now, Professor Winner mentioned that screening tests be done by immunochromatogram, that is ICT, and confirmation by ELISA is necessary. That is very important, it's necessary. Primarily, the HCV testing should be thoroughly done by third generation ELISA. So I don't want to mention the complete name. Now let us try to squash about this one. Especially one recommendation and two. So especially, may I have the points and the views of the hepatologist and the gastroenterologist before we try to adopt it. Just concentrate on the 1 and 2.2.
1 and 2.2.
So
Give me
whether the
Whether they
hepatologist
go-
agree about the third generation
Or-
ELISA,
There.
what is the reason for? You want to care about the third generation ELISA?
agree ဖြစ်ပါတယ် one ကလည်း agree ဖြစ်တယ်ဒါတော့ကိုကြိုက်လို့ကိုယ့်ကိုစစ်ပြီးတော့သိညာလည်းရှိတယ်ဆရာဝန်တွေနောက်ပိုင်းလည်းသူကလည်း open discretion နဲ့စစ်တာဆိုတော့the statement one is quite okay statement 2မှာလည်းscreening က ICT တန်းမှ ICT ဆိုတော့ and confirmation မှာဆို ICT နဲ့စစ်ကိုဆင်အောင်ဒီမှာလို့ဖြစ်နေမှာဆိုတော့ and ဒီမှာလို့လား ICT နဲ့စစ်လို့ရှိရင်တော့ ELISA နဲ့ confirm လုပ်ပါဒါမှမဟုတ် ELISA နဲ့လုပ်တဲ့စစ်တယ်ဆိုရင်တော့ confirmation ကလို့တော့စလည်း ICT နဲ့မစစ်ပဲ ELISA နဲ့စစ်တာဆိုရင်တော့ third generation ELISA ကတော့ခုက everywhere မှာလည်းmost မြို့ကြီးတွေမှာလည်းရနေပြီဆိုတော့ပါပေါ့
Whether you should go straight for the ELISA or whether we have to get initially
ဟုတ်
the ICT.
ဟုတ်
Which one do you recommend?
နေမှာjust ဆရာ in our level, rural level, and some district level, ICT is only available. But in the larger cities like Mandalay, Yangon, Jaro, ELISA,
You want to, if it is possible, you want to go straight away for the ELISA?
yes, yes, because we see some false positive results or false negative results by ICT.
Right.
What do you mean by, according to the discretion of the attending doctors, or patient own desire is okay? What do you mean by according to the discretion of the attending doctor?
So what CIA is saying is whether our attending doctor in the rural area has the knowledge whether to carry out ELISA first and ICT first and followed by ELISA.
Yes.
If the patient wants to get him tested, it's okay. But why the doctor choose a patient that he should be tested? According to discretion in, is he at high risk?
So if the ICT is negative, we don't want to do ELISA.
It's
We
necessary.
will proceed with ELISA.
What about the cost?
Cost cost, yeah. It's cost cost. ICT cost only. Actually, they charge around maybe 5,000 or something like that by ICT. Actually, the test strip cost around 1,000. Some are so cheap, or maybe it can be available around price of 500 or something like that. But it can get.
How you comment upon this? How you comment upon this?
Yes, I totally agree with you.
Okay.
Because ICT နဲ့စစ်ပြီးတော့လေအပြည့်ရုံတော့မရဘူးလေ
Yeah, positive, false positive, false negative တွေကများတယ်
Other hepatologists, why don't we go straight away for the ELISA?
So sir,အဲ့ဒါ
ဆရာတန်
we would like to go straight forward to the ELISA, but many people would have the several sessions.
ဆရာအဲ့ဒါဟိုပါလေအစာချင်ကြီးကလည်းဆန်းနေတယ်ဆရာဟိုကဆရာအစာချင်ကြီးကလည်း discretion ဆိုတော့ pre-op assessment ဆိုရင်သူတို့က NAC လို့ဆိုတာရှိတယ်နောက်တစ်ခုကကြတော့လေ OG တို့ကတော့ပုံစံကြတယ်ဒီလိုပဲနောက်တစ်ခုကကြတော့လေ patient are very funny symptoms very vague and no specific symptoms they are complaints if we see any abnormality in clinical examination in the laboratory so in CO such sit down.
Any comments? Yes, please.
Hepatitis C လူဆယ်မီကစ်မှာရှိခဲ့တဲ့ဆိုရင်မိဘဒီပုံပေါ်မှာဒါမှမဟုတ် spouse ရှိခဲ့တဲ့ဆိုရင်စစ်တဲ့
Risk yes.
ဒါပေါ့ breaks at breaks ဆိုရင်ဒါဝင်ကဆရာဝန်က disagree လုပ်တာဆရာ
ကျွန်တော်တို့ရဲ့ policy လူတိုင်းကိုစစ်တဲ့ဆိုပြီးတာ
ဒါတော့
လူတိုင်းကိုစစ်တဲ့ရှိတယ်
So do you have any comments on this particular statement with point two? Screening can be done by ICT and confirmation by ELISA is necessary. So if it is negative, we will go to ELISA. If it is positive, yes, you have to go to ELISA. That's one thing. Another one is primary anti-ACV testing should be preferably done by third generation ELISA, which I really recommend. But I don't know whether the patient could afford it or not. But from the hepatologist point of view, whether I would like to hear a different point of view, whether the availability of the test and the cost, then the affordability by the patients. And the reward going to be kept by the patients. Let me have your opinion.
You understand?
ဒီပိုင်းကလေးကြာတယ်ကျွန်တော်ဒီတိုင်းတဲ့ခိုင်ကြီးဖတ်ကြတာအဲ့ဒီကနေပြီးတော့ဒီအကြောင်းမှအပိတ်တယ်မလုပ်ဘူးဆိုရင်အမှန်ဒီဥစ္စာ
Hello.
အကုန်လုံးနဲ့အဲ့ဒါ
Hello, we have discussed this
အဲ့တော့
for your this has been already discussed. And these we don't change very much.
Yeah.
The changes in the HPV and the RNA and the testing and the treatment. Daria says and I really fully appreciate from the London's comment. This has been discussed many years back and we don't change very much.
Okay.
Okay, if everybody agrees, then we will stay, put it like this.
Yeah, that is,
You're right.
take time. The only comment is that, we did final documentation, so Zakim, Boya, reference there.
Tell me,
Look, page divided.
yes, we know, a year or tell
Vancouver system, Harvard system.
Yes, a year or
Whatever the system.
Yes.
Usually, the look guideline is in the Vancouver system. Vancouver system, 1, 2, 3.
အခုပြောင်းပြပါမယ်
Vancouver system 3 လား Harvard system 3လားအဲ့ဒါရဲ့အတိုင်းလိုက်
ဟုတ်
ဒါမျိုးတွေမှာများတော့ Vancouver system 3
လောက်ပြပါ
အဲ့
လောက်
ဒါ
ပြပါ
လေးကိုသူက secretary
Yes,
မှာ
you're right, prof. That. ဒီမှာလုံးလုံးပြောင်းသွားတယ်ဒီ assist တွေမှာအရင်တော့ကျွန်တော်တို့ကပြောတဲ့ qualitative quantitative လို့ရ qualitative assist တွေကလုံးဝမလုံးတော့ဘူးဆိုတော့ and quantitative assist မှာကျွန်တော်တို့အရင်တော့50 IUD လက်ခံတယ်ခု2013 ESOL မှာ15 IUD ပဲလက်ခံတယ် လက်ခံတော့
အဲ့တော့သူ့ဟာဒီမှာ15နှစ်တည်းပွားတယ်ပြောရမယ်
အဲ့ဒါကြောင့်မလို့ဒီမှာ recommendation မှာဘာကြောင့်ဒါထည့်ရလဲဆိုဆက်လိုက်ရမြန်မာပြည်မှာ qualitative assay ကို3နေလုံးတွေ့နေသေးတယ် qualitative တွေလုံးဝမသုံးသင့်တော့ဘူး real time qualitative assay ကို maximum lower limit of 15 IU ဒါကျွန်တော်လွန်ခဲ့တဲ့နေ့ရက်ကESA 2011နဲ့ASL 2009လို့တော့50 2013ထွက်လာတော့မဟုတ်15 IU ဖြစ်သွားတယ်ဆိုင်တို့ဒါတို့ပြောင်းသွားတာလား
Yes.
လုံးဝပြောင်းသွားတာတွေ့ရတယ်ဒါပြောတာမရှိဆိုကျွန်တော်ဆက်သွားမယ်
No, just wait a minute. Well, Professor Williams talked about the
PCR assays with regards to quantitative, and the recommendations.
Well, whatever here, Professor Wynn has presented, would you like to order anything or substitute anything? Your needs are welcome.
So I know, don't get away, get it on. Any comment?
If not, we'll pass it over.
သဘောတူပါတယ်ဆရာဘာလို့လဲဆိုတော့ဒီ CRNA assay ဒီ hepatitis CRNA assay lower limit of quantitation and lower limit of quantitation is around 15 IE and it can be available in Myanmar ဒီ Mandalay ရောရန်ကုန်မှာပါရဖြစ်တော့ဒါဟိုနောက်စစ်မဲ့ဆွေးနေဒီ RNA assay တွေကမြန်မာမှာမစစ်တာဒီမြို့ပဲပို့ပါဆိုတဲ့ခါကျတော့ဒီကွေးပါဆရာ
Hello, let's go.
ဖွင့်ထားတယ်ဆရာ
I don't know.
ဒီလိုနီးနီးလေးပဲ
Sometimes here, yeah.
Okay, you agree?
So any comment from
Other pathologists and PA specialists?
မဆွေလို့ဆရာက
ကျွန်တော်ကတော့ဘယ်လိုလုပ်ပါလဲ
agree ပဲ
Good. Agree? Professor Wynn, please go ahead.
Chinudami. Chinudami Malachino Beyond is not. I'm not a qualified person. Probably you will know better. General, Library of the Senate Sana Sire, now below PCN Sana Sire. PCN is the right sequence Sire. The right sequence in the PCI, Choinjaka, subtyping or Lolumia. Library of the Say, Indolipa Sia, subtyping, you have 1A, 1B here. 1A, 1B, Pama Yemju Tingere. Dodole, a good. The Dona Kama, 1A, 1B လို့မကောင်းဘူး 3B ကမကောင်းဘူးဆိုရပြောလာတော့ subtyping ကလိုလာတယ်လို့ဒါကြောင့်လို့ကျွန်တော်တို့ကဒီရှစ်တောင်အာရှကိုကြည့်လိုက်မယ်ဆိုရင်လည်း we look around our neighboring countries most of countries like Singapore, Thailand, Malaysia are using library assays so I just have to say that genotyping with the subtyping library assay, Barcent ACP Libra 2.0 is the most widely used for the DNA genotyping testing. Around Europe.
ဒီကိစ္စကိုပြောမယ်ဆိုရင် in our reviewing the genotyping method ပေါ့နော် full method လောက်ရှိတာဆရာ I am totally agree with Prof. Kamal's statement. However, statement in the moment, here we have the facilities of genotype by LIBAR assay and also by the PCR and MMP0% because we are treating the patients with only 2 drugs regimen, speculated in the rivalry and subtyping neglected time. And if the patient has a treatment failure and the patient would like to retreat, at that time we have to review the previous data and we have to recommend which regimen should be chosen. And at that time, subtyping is very important. Make it to those years. Can I miss it? No, subtyping to
Mr. Chairman,
Yeah.
hello, General, Hindua Chin, Chinamama didn't Chin, Flanchen, Yobian, to according to the studies, they don't want to down in the money. General, the right sequence in a semester, Tamo PCR and a semester, so subtyping would be. Inoliba Library says National University Singapore subtyping T. Subtyping material how to look high. The Joe, a town is on the job, you are responsible who deal and so you need to test again. For genotype and subtyping. Download Genoro. That's it, Shidia. Yanagama Lolo Mia Dole. Library say 2.0 there. Subtyping theory. Genotyping method was a thumb in there, so we can recommend that.
Yes. Although I'm not a hepatologist, just by listening to your presentation earlier, I'm comfortable with your suggestion. However, here I would like to suggest the sentence. If I have to suggest, in view of the emerging evidences showing the response of the subtext to the DDA therapy, genotyping test kit with the ability of subtyping should be used. I would rather use that sentence rather than the current one. This is my humble suggestion.
In view of the
emerging evidence. In view of the emerging evidence.
Yeah, you know, Messiah, we don't tiny, banana. Throw Messiah. Throw banana. Imagine, tiny. Messiah.
ဆရာဝင်းကျွန်တော်ရှိပါတယ်ကိုလက်ပြောတာမှန်တယ် You have used the word in the responsive therapy which we haven't adopted it yet ဟုတ်တယ်မလားဒီကျွန်တော်လက်မခံသေးဘူးလေဒီမှာတော့ဆက်နောက်မှပြောဒီနောက်မှပြောမယ်ဒါပေမဲ့ဒီမှာဟိုတော့ဒီလက်မခံမယ်ဆိုမလို့ကျွန်တော်တို့ကမပြောက်ဘူးကျွန်တော်စင်ကာပူမှာတော့မယ် ဆရာကျွန်တော်ဒီနေ့နဲ့ထားမှာလားကျွန်တော်တောင်းဆိုထွက်တာအများကြီးပဲဒီစင်ကာပူထွက်ရတယ်စင်ကာပူမှာ available ဖြစ်နေပြီလေပြည်လေဆိုတော့အဲ့ဒီတော့မှဆရာထပ်ပြီးတစ်ခါ genotyping နဲ့ subtyping ထပ်လုပ်နေရတယ်အဲ့ပြဿနာရှိတယ်ပေါ့နော်ဆရာ there are many people who can afford the DA in Singapore Sela, I fully agree with you althoughအခုမတက်နေလို့ဒီမှာမပြောက်ဘူးကျွန်တော်စင်ကာပူနဲ့လို့ကျွန်တော်တို့လည်းတော့ရှိတယ်ဟိုတော့မှသူက subtyping နဲ့ genotyping ထပ်လုပ်နေရတယ်လေဟိုဆရာမလို့လည်းသူကသူသွားတယ်တဲ့ပုံကြီးပဲဟုတ်ကဲ့ let me be frank so these are the people who lives in our country only a few percentage can go abroad but the guideline is for is a general guideline. We should use the word general time. Dharma, but you will find in the later part of my presentation about the DAs. Genotyping general subtype mention, mere flanchen. အဲ့လိုတိထားတာကမားတော့မမားဘူးလို့ကျွန်တော်ယူဆတယ်လေ။
အဲ့ဆိုယူမီကဂျပန်မှာနေတော့ကယူမီကဂျီနိုတိုက်ပင်ကိုယူမီကလိုက်ပါနဲ့မလုပ်ခဲ့ဘူး။လိုက်ပါနဲ့ကယူမီကရန်ကုန်ရောက်လို့ဆရာကြီးစီမှာတာမှာလိုက်ပါနဲ့လုပ်တာယူမီကဂျီပေါ်မှာဂျီနိုတိုက်ပင်မော်လီကာဂျီthat's all the whole gene will sequence ကိုအဲ့ဒါလေးလုံးဝ trick ပါလေ
ဆလာ
genotype ကို sequence ကနေမှာ gene sequence ကိုမှာ gene sequence ကို synthesize လုပ်ပြီးတော့အဲ့ဒီကနေမှာ gene ကို genotype ကိုပြန်လုပ်တဲ့ method ဒီ PCR နဲ့သွားတဲ့ method တွေပဲဂျပန်မှာတော့ train လုပ်ထားတာအဲ့တော့ the whole genome sequence ကို map လုပ်ပြီး star ယူပြီးလုပ်တာဒါပေမဲ့လို့ လိုက်ပါကြတော့ဒီမှာလုပ်တယ်ဒါပေမဲ့ difference ကအဲ့ဒီမှာသွားတယ်ဒါပေမဲ့အရင်တော့က gene ကြည့်ထားပါတယ်ဒါပေမဲ့ဒီမျိုးတစ်ခုရှိတာအရင်တော့ကဆိုပြီးတော့ laptop တွေပါလို့ဆိုရင်ဒီတိုင်းမရနိုင်ဒီမှာတိတ်နေစေသူမဝင်နိုင်ဘူး test ဆို10 minutes ပဲပါတယ် everybody's available နောက်တော့အခု phone တွေဆိုရင် everybody's like smartphones everybody's available within a 1 to 2 or 3 years maybe the DA available everywhere ဖြစ်နိုင်သေးတယ်
ဟုတ်ဆရာ
we need to find
this,
a few words
ဆရာ
only
ဆရာပြောရလို့ပဲလေ
Can I-
preferable ပေါ့ဆရာ preferable ပေါ့
Yes.
Yes.
ဖြစ်နိုင်စစ်ချင်
Can I suggest,
Yes, yes, yes. So,
just to write down the appropriate sentence here,
ဆရာဆ
and
ရာ
then we review it again after the end, at the end.
ဆရာဒီမှာဆရာဆက်ပြော
Well, I would like to accept the word as a moderator for clarity.
Yeah, preferably better, how about it? How about it?
ဆရာပြော
Okay, let me finish the sentence, then
Yes,
we
yes, yes.
will go on.
Sarah, Sarah.
In view of the emerging evidences showing the response of subtypes, showing the response of subtypes to the DAA therapy, preferably genotest kits with the ability of subtyping, preferably should be used. Preferably should be used.
Showing the different responses of.
Would you like to rephrase?
Let me finish the sentence, then I will continue.
Repeat
Compliment. Sarahပြောတယ်အပေါ်ဒီလေးလုပ်တယ်
In view of the emerging evidences showing the responses of subtype to DAA therapy, to the DAA therapy, genotyping test kit of Wahao